Good morning, good afternoon, good evening, depending on wherever you might be watching us. It is a pleasure to welcome you to this webinar. My name is Kilian Songwe. I am the president at the Global Healthcare Public Foundation and also as chief scientific officer. I'm an expert in management systems and a lot of experience around the world doing program development and policy for governments and big institutions. Global Healthcare has been around for the last 18 years, doing a lot of work in healthcare development for low and medium income countries. We do a lot of certifications for different enterprises, both public health and non-public health enterprises, taking a number of them to international certifications. At this webinar today, we intend to take you into the situation room and look at all the challenges, not all the challenges, but most of the challenges that a lot of countries, especially on the African continent, have had to deal with as we've gone through the coronavirus, commonly known as COVID-19. So we're going to take you through three really epic stages. Stage number one. Stage number one has been the lockdown. And then from the lockdown, the issues of testing. And then now for most of the countries on the African continent, it has been the big discussion about how to reopen and if it's the right time to reopen. So that's the discussion we wanted to take you through today. So just looking at this, Africa's challenge in the healthcare context is really it's a twin problem. We have a high existing disease burden on the continent, and we also have a very fragile health system. There is no secret to it that as the wave of the virus went from Asia to Europe and then to the States, there was a huge pandemic, there was a huge panic on the African continent as we looked at our readiness to be able to deal with the kinds of numbers that Europe and the United States and now South America is dealing with. Take the case of Brazil, for example. It was estimated that on the entire continent, there were less than 30,000 ventilators to be able to take care of well over a few billion, 1.5 billion people. That's a really small number. When you also look at tuberculosis and HIV and how widespread they are on the African continent, it is said that 94% of all malaria deaths, while mother and child diseases are fourfold higher on this continent than in any of the other regions. So there is a great need from a healthcare, from a public health perspective, to not just look at the coronavirus and its impact today, but to also look at the readiness of our healthcare systems to be able to take care of the other diseases that are already ongoing. So I just want to, it's just so that we can appreciate what is going on in the situation rooms. And I'm talking about the situation room, both from a government perspective and from the public perspective. Because governments have to think from a multi-sectoral point of view. Foreign affairs has to come in, security has to come in, departments of education have to come in, departments of homeland security, department of territorial administrations, our security services. All of these things have to come in. Of course, our health sectors, ministries of health, are all players in the multi-sectoral approach to this. So I want us to look at that from both government and from the private sector. When you look at this graph, and I called this graph yesterday, this is April of 2020. When you look at what is going on the African continent, you see the entire African continent had well less than 40,000 cases. That was April 1 of 2020. When we now go fast forward to June 12, which is Friday last week, when you look at the African continent, these two graphs, and I actually interplay them just so that we can get a chance to look at them. and then see in perspective what is happening. What you generally see here is that, South Africa seems to have gone a little bit above the 40,000 mark. But these two graphs are a little misleading because it is very easy to think that the entire continent of Africa is actually managing cases well below 40,000, which is not true. So I've actually gone a step further so that we appreciate what is going on the continent, to be able to look into the lockdown and the testing and the reopening from a very different perspective. So you look at countries with less than 100 cases. And I highlight Lesotho because Lesotho's case was just announced last month. Their very first case, I think, was the 13th of May. Lesotho went into a massive lockdown. It was a total lockdown. And again, you could also argue that it's a small country in size, just a little under 2 million people. But they had a very massive, very strict lockdown. But when you look at the countries with less than 100 cases, and then you go over to countries with less than 500 cases, and you look at a small country like Benin. Benin is an equally small country. It has less than 7 million people in the country of Benin, but they have 442 cases. Again, very related to the nature of the lockdown that they had. And we go over to countries with less than 1,000 cases. And as you look at countries with you look at a country like Chad, that's a typical example of the healthcare infrastructures that they have. Chad is a country that is still building up from many years of different kinds of engagements. But also, when you look at a smaller country like Rwanda, 582 cases. We know in the case of Rwanda that there were measures that were put in Rwanda much earlier on to be able to mitigate the spread of the virus. But also, when you look at the case of Rwanda, it might also be a case where the levels of testing might actually have been very high. So they're able to report high numbers for a very small population. Going forward, we look at, these are countries with less than 5,000 cases, and you have the DRC, and I specifically highlight the DRC because the DRC has other morbidities that are going on there. We have Ebola. Just a few weeks ago, it was heard that there was also cholera in that area. So there are things that the healthcare system has to be able to address. There is Kenya, 3,594 cases as early as last week. South Sudan, we're not sure what is going on in South Sudan. I know that the cases of testing in South Sudan has certainly not been as robust as it should be. So when a number like 1,693 might actually be higher, but then we have countries with greater than 5,000 cases. There is Egypt and there is South Africa. South Africa actually is now the highest on the continent. But also, again, South Africa has a very robust testing program that they are actually carrying out. And as a result, you could see such high numbers. So just looking at the African stats, and today is June 15th. So this is this morning. We have 242,000 cases or 243,000 cases between when I started looking at the numbers in this presentation. 6,500 deaths. We have a good number of recoveries. I think that's the good part about what is going on here. That is almost 50% of recoveries to cases. That's a good thing. Active cases, as of June 11, we had 100,000 cases. This is something which we have to pay attention, and this is one of the things that all the nerve centers, all the task forces, and all the big businesses are supposed to be paying attention to. The World Health Organization says that the pandemic in Africa is accelerating, but we might actually think it's accelerating because we're now beginning to do more testing than we did in the first 100 days. So it says that in the first 98 days, we had 100,000 cases. However, in the last 18 days, we have 200,000 cases. So we have to stop and actually evaluate our testing methodologies in the first 100 days versus our testing methodologies and how many tests were actually run very, very recently. So I just throw this in for us to be able to figure out and to appreciate where we've come from and where we are. in terms of the transmission. So we are just about phase 5. It is truly a pandemic, it is that. And so some countries are beginning to accelerate, China into the post-peak area. Of course, there is still the widespread, and then the post-pandemic time, which is soon coming up. But this between post-pandemic and possibilities of recurrent events and the total post-pandemic, I hesitate to say, but for a virus like the coronavirus from the SARS family, we've not seen enough of it. We've not learned enough of it. It's only been around the last 7 months. So I look forward to at least about another 12 months for us to be able to appreciate it, understand it. I don't expect to see a vaccine anytime soon. And even if there is a vaccine, we're going to have a lot of studies on the vaccine between the different continents, the different regions, and to be able to understand its morphology. So very quickly, this just goes back to the open and recovery plan. Yes, there was a lockdown, and then testing and contact tracing, and then the reopening. But I just throw this line at the bottom here, just for us to be able to be thinking about the African continent and some of the things that we need to be discussing in the situation room. And this situation room I'm looking at is the situation room between countries, within countries, between countries and regions. And then for continental Africa. So right now we have Ghana, we have Senegal, we have Uganda, Kenya, and South Africa, which are the only 5 countries on the continent which are currently actually in some test development stage. So we can actually have test kits made on the continent for a reasonable cost price. For most of them, they all say they're less than $2 to $5 a test. Very useful, that can be used on the continent. So just looking at this again, we're looking at the lockdown. So generally on the continent in Africa, the lockdown actually began in end of February, with Nigeria being one of the first countries to lock down. But again, different countries went through the lockdown, but different countries went through a very, very different grade of lockdown. So you take, for example, the case of South Africa, which went to a nice extreme, the banned alcohol, the banned tobacco, for example, as part of their lockdown policy. And then you have some other countries, Kenya, for example, or that actually had just a lockdown between its counties. So there were different sets of lockdowns, from very rigid to very robust to very, very light lockdowns. And there has been an impact that we could actually measure with the cases that have public health, thinking about it from a country perspective. There are at least, thinking about it from a country perspective, we have a couple of things that we can look at when we think about what should government do, or what is the reaction that different countries should have. Basically, they just have to look at how painful is the lockdown going to be? What are they going to do where they can say that there is going to be no regrets from doing it? Or how effective but less painful with the lockdown be? So I throw in this chart, actually, it's a 4-quadrant chart that I'm looking at. And basically on this 4-quadrant chart, we're looking at the evidence of effectiveness of the lockdown, and whether it's low, medium, versus the level of pain, economical or social, to the citizens of the country. So when you look at fundamentals executed at scale, strongest evidence of high efficiency, efficacy, versus low, medium levels. You look right at the top there were issues of protection of essential health workers, contact tracing, limited, time-limited quarantine, and this was voluntary quarantine for a lot of people. And then you look at some evidence of effectiveness, but low and medium pain on the economy, on the social side of things, operated through the pandemic. These were lockdowns that were not very strict. There were signs, there were symptoms, but people still went around their business. A lot of the quarantine was voluntary. Large gatherings in some cases were not completely stopped. So those were some things. Now you look at the other side of the other two piece of the quadrant, and now you could correlate this piece of the quadrant with some of the cases, case numbers that we see. So we have most painful, yet highly effective, but also high pain and a huge impact on the economy. This was full shutdowns, restricting movement in and out of cities, states, borders completely closed, mass transportation shutdown. This was a literal shutdown of most nations. So in that case, yes, we can show, again, you use Lesotho as an example. There is a great story out of Turkey or Vietnam of things that have happened there. And then you come down to effective but painful. Yes, this was a little bit moderate. Stop small gatherings, e.g. churches and sports games. Shift primary schools to remote. A lot of schools have gone online. Or shift higher education to remote. Most people are now having their classes from home. So within this quadrant, you could actually see the effect of the lockdown in different nations and what was expected out of them. But now this is really what is important when we think about the lockdown. I know the question has been asked so many times, was it necessary? Should it have lasted this long? This quickly just says the virus came from the bat and then it went to man. However, if you look at this, basically what is important about this slide is actually the fact that for every one infected person, there is a potential of having 3 other people infected. And this is really what is important about the lockdown. Because if you looked at a country that has 44 known cases today, if you took 44 known cases today and you're thinking about a transmission rate of 1 to 3, if the R number hasn't gone any lower than that, then you're thinking about 126,000 people who are infected. So that's a high infection, and that's one of the reasons behind which the lockdown was important. So people continue to ask, so why the lockdown? And I must say right off the back, I borrowed this straight from my good friend, Dr. Alex Catino, listening to him the other day. He spoke about this really important reasons to do the lockdown. Prevent importation, that's why we close the borders. Prevent spread and try to flatten the curve. That's our new lexicon, trying to flatten the curve. Build awareness of the disease so that people can begin to know, build awareness of signs and symptoms. There's been at the very beginning, we learned how to cough. We learned how to cough into our left arm, and then we've moved from learning how to cough in our left arm to not coughing at all, to using a handkerchief or a tissue or that kind of a thing. So there's been progression around this awareness. Start testing. It was crucial. Lots of nations, even the Western nations, were not ready to do testing. So we, as a continent, we had to do the lockdown and be able to get the test ready. Build capacity for health systems to be able to absorb the cases. Many health systems have had to make major changes to be able to absorb the new cases. Some hospitals have had to shut down wings of their operation. Some other countries have had to use schools as a place to absorb their cases. Conduct contact tracing. This has most probably been the most important element in the try to prevent or reduce the number of cases. Contact tracing, quarantine, and isolation of cases as we know them. But also try to find out where the hotspots are, identify where new cases are coming from. That is really important, because as soon as we can identify areas of new cases, then we can also move very quickly to increase testing. We can also move quickly to be able to monitor any potentials for community spread. So this is a slide which I threw in because it's rather a very important slide. When we think about the shutdown and crisis management, the 2 things that have happened here that we want to look at. So first and foremost, there is the virus. Safety measures were put in place, economic shutdowns, reduction on workforce, just to be able to mitigate the fact that there was any transmission of the virus. When you think about safety measures, these are all personal things, part of people's personal hygiene and looking at the public. Economic shutdown, yes, it had a huge impact on the revenue, but there's really nothing that could have been done from a public health perspective in terms of prevention. But there's been loss of business and loss of livelihood. That has really been really bad. And then we look at the consequences of some of this and what has actually happened. So we have huge loss to business. Today we're talking about reopening. There are many companies that are not going to reopen. We talk about livelihoods. Lots of families that have lost the breadwinner, or the main person who was responsible for income. Personal finances have been very hugely touched. A lot of, and we're going to look at this very shortly, the impact of COVID on the formal and informal sector. So government has to step up, and government has to try to support, whether it's families or business, banks, and relook at people's loans and those kinds of things. So from a risk point, both governments and the private sector have had to look at COVID-19 and think about what is it that they're going to be able to accept and what is it that is going to be unacceptable to them, either from a government perspective or from the private sector perspective. And this is really important because going back to the whole idea of the situation room, there is a lot of thinking, and this is where we have to think about cross-sectional thinking. This is not about who is at the top of the hierarchy. This is about everybody trying to think about what could happen. So I already spoke about the transmission rates, and as a reason for why the lockdown came, what was the goal behind it, was just to reduce the spread. So talking about testing, this is a huge thing that has to be looked at, because when we go into testing, we've never had to do this before at this scale. But we've not only never had to do it at this scale, but we've never had to do it at this scale and not have the right testing kits out there to be able to do it. So that has been an added challenge with the coronavirus or COVID-19, as it has come to be known. So basically, we have two kinds of tests that are out there. There is a viral test that basically says that the virus, and then there is an antibody test. The antibody test, which basically says that you've been exposed, commonly known as the serological test. So those really are the two tests that are out there for COVID-19. But again, this is where the challenge comes. For the two tests that are out there, basically these two tests, most of us have heard about the emergency use authorization. These two categories of tests that are out there literally have actually come into play using the emergency use authorization from the FD&C Act, because basically there has not been enough testing to be able to ensure that the test would actually give us true positive results, commonly known as sensitivity, or true negative results for negative people, commonly known as the specificity of the test. So emergency use authorization has been given to well over 670 biomedical groups, pharmaceuticals, to be able to come up with test kits that can be used to be able to test for the COVID-19. So basically, looking at this again, we know there are a number of phases to COVID in different countries. We started off with no cases. We just listened to the stories that it happened from Asia to Europe and to the States. Then a few sporadic cases. For most countries, this were either immigrants flying into the countries, and then there were a few cases. And then we went to cluster cases. And so for most countries right now, we are somewhere between, except for countries that are less than 100 cases at this point. But for most of the countries, we are somewhere between clusters and community transmissions. That's the phase 3 and phase 4 of the COVID life cycle. So low testing to exponential cases. So this slide actually tells you, it reveals what is going on the continent for the most part. And when you look at countries' populations per million, this is Mauritius, 1.3 million people, South Africa, 59 million people. And you're looking at, they're doing 7.1 tests per 100,000 people. So you can see that there is still very, very little testing that is done on the African continent. And we're going to look at some of the issues behind this. And again, there is so much to be thought about. There is so much discussion that needs to go on from very high levels to be able to think about how can we rank up testing. So most countries are doing well less than 1,000 to 1,500 tests a day. I think if you have a country with well over 20 million people, we should be thinking about doing 10 to 15 to 20,000 tests a day. At this rate, we should be able to test more than half of the country sooner than later. But this second slide actually is what is more troubling when you look at what is going on the continent. And this goes back, if I may, take you back to the WHO comment earlier on. So in the last 100 days, we've exponentially grown from a few cases to almost 200,000, 200 plus cases. But yet, what has actually happened is when you look at the slide, the picture, the image up above, you still see that we're not testing as robustly as our friends in Europe or the Americas are testing. However, you can see this picture. So this only accentuates the fact that we really need to be looking at our health systems. We need to be looking at readiness because we're all going into opening our different countries. And as we open those different countries and we look at these two figures here, where testing is still reasonably low. However, we have an exponential growth of positive cases. So again, talking about the phases, as I mentioned earlier on, we're clearly within phase 3 and phase 4, we're moving out of clusters into huge community transmissions. So talking about testing again, there is a huge consortium of different organizations from WHO, UNICEF, Bill and Melinda Gates, the Clinton, that are all working very hard on behalf of the nations of Africa to be able to ensure that there is a good pipeline that can go to the countries. And this is very useful. And again, I just use this slide to call on blocks of countries in the different regions and to, again, extend our best wishes to Africa CDC for the work that they do to be able to ensure that these test kits can get to the different countries in the shortest time possible. So there is testing going on, not as robust as we would want to have it, but then we've gone through the lockdown, and then somewhere in between the lockdown there is testing, but we're talking now about reopening. So a lot of countries have been in a lockdown phase for somewhere between 45 to 90 days, somewhere in that space. A lot of countries have been in lockdown. Huge impact to both the formal sector and the informal sector. If you look at just, if you took retail and wholesale, for example, we're talking about close to 60 to 70,000 people, 60 to 70% of the people are going to lose their jobs. Or at least there is another 30 to 40% that are at risk of having salary reductions. And that's a huge impact to an economy or to a household that is very reliable on a ripple effect of income. You look at the construction industry, yes, there is going to be a little shortage. The agricultural space has not moved that much. But when you look at the agricultural space in the informal sector, yes, it has had a significant hit. There is, well, we're talking about in the informal sector, there is almost 300 million people in the informal sector that are working in the informal sector. And I'm looking at least another 100 million of these people completely being out of jobs, while in the formal sector, somewhere between losing jobs and having a salary reduction, that's going to be about another 50 million people. So when I'm just thinking, a paper I read out of McKinsey a couple of weeks ago, we're talking about 150 million people who are going to be out of any sort of revenue or income as we move into the next couple of weeks and the next couple of months. Again, that's going to have a huge impact on people's mental health. It's going to have a huge impact on people's well-being. It's going to have a huge impact on the things that happen in our society. So it's not just about the virus. And this is why the situation room becomes really crucial. When we sit in the situation room, we're not just looking at the health aspect of what the virus is doing to us, but we have to look at what is going on from the social aspect of things. So it says there are 4 areas to focus on. There's a recovery revenue that has to be looked at, rebuilding operations, that is key, rethinking the organization. A lot of organizations have morphed in the last 90 days. There were organizations or breweries, for example. Let's take a brewery, for example, that was producing liquor, and they've now had to stop producing liquor and produce sanitizers because we need 60–70% alcohol in the sanitizers. So there is some rethinking that has to happen. But this rethinking also needs to be supported by government subsidies to be able to move from one set of business into another set of business. So going forward into thinking about the reopening, I think this is where a lot of energy needs to be spent, because it's no longer about COVID. It's a lot of the fallout on what happened with the COVID, what happened as it came onto the continent, what happened during the lockdown, how much testing has been done, and now can we go back into doing business as normal? So there is the whole discussion about setting up nerve centers, trickling down, setting up control towers. How are the discussions going to happen? It's about communication, and now it's not communication from top to bottom. This is communication across all sectors. So I looked at this, so network of teams. So for us to be effective in trying to do anything around the virus, we have to set up this network of teams. And when you look at this network of teams from A all the way through H here, we're looking at leadership, response from leadership, what kinds of teams need to be set up. There is medical advisory, the network project management, different levels. And we're going to look at some hook and spoke relationships on how this is cascaded from national level all the way to the lowest level of government, depending on the different countries. So of course, then you have action teams, people who are responsible for communication. There are countries that have multiple languages. All the information and the communication material has to be translated into numerous languages. We need to think about supply chain. How do we ensure? I think there is nobody on earth today who has not heard about PPE. They might not know the full of it, but they have certainly heard the acronym PPE. We need to ensure, how does this PPE get to where it's supposed to get to? What are the technologies that are out there for either testing? Everybody today has seen the temperature gun. At least most people have had it used on them. There is technology both for the healthcare point, but there is also technology that has to come into play for the safety of employees. I'm just thinking at something as simple as an access card versus the traditional biometrics of using a thumbprint or placing your eye to be read. That's an opportunity for contamination or transmission of the virus. So we need to think about this network of teams as a successful way of trying to be able to move on. So I said I was going to look into the hop and spoke mechanism. I know at the very beginning, the big issue here was to think about what was the human resource that is available, and how do you immediately try to use that human resource to be able to reach the country. And so if you look at the very first one here, where basically you start off with a central mechanism trying to set up, and then you start thinking about what is going to be your hotspot. Where are the potential hotspots going to be, and how are you going to be able to take care of those potential hotspots? And then you don't only think about them, but now you actually set up the hub and spokes to be able to meet all these different sub-teams. But again, I think what is also important and crucial to remember here is to think about the levels of communication. And the levels of communication is very important, because those levels of communications actually allow us to ensure that what we are trying to transmit actually gets transmitted. And I'm thinking about something as simple as ensuring that the test methodologies are actually done the way they are supposed to be done, ensuring reliability of the results that we get. And now you take the hop and spoke to an additional sub-teams. This is really going as far down into the grassroots possible, so that it is done, but one person replicating themselves at different levels. This is one person replicating themselves at different levels. So let's say you were at the national level, and then you would have somebody at the national level, the same office being replicated at a regional level, and then from there at the district level, and then down to a local council level or something of that nature. But what is interesting to note is that the distance of separation actually reduces as we build this, because we continue to ensure that the information gets out as fast as possible. We're building hub teams, and we build a strong network of teams. But what is also key to note here is this is a great opportunity that as we sit in the situation room and we try to look at going forward, we're supposed to start thinking, how do we use these mechanisms? How do we use these networks that we're building so that when the COVID is gone, when this pandemic is gone, how do we use these networks to prepare for the next pandemic? And I really don't want to be preparing for another pandemic. But just in case there is an epidemic that comes up, we want to be ready. We want to have a network that knows how to communicate. We want to have a network that knows how to report. We want to have a network that knows the layers and the infrastructure that is required. And when we were talking about a network and infrastructure that is required, I think this is one time, if never before, that the whole element of information technology, the hardware around information technology, the software around information technology has become more and more important. Just the very basics of thinking, we need to be able to have data, because data is going to be important in allowing us to be better prepared. So this is a nice slide I got from McKinsey and Company, talking about the reopening and recovery plan. And it just looks at these stages in a very simple yet very critical way. It talks about maintaining health system capacity. We do have an existing health system capacity, but it was not the health system capacity designed for a pandemic at the magnitude of COVID-19. Ensure public health, protect vulnerable people, which is a lot of people in many cases, safeguard society and industry, minimize societal adoption to protective measures. And what are the key questions that you look at as you go across the board? Let's look at protect vulnerable populations, for example. There are people who are vulnerable. They're diabetic, they're hypertensive, or any one of those things. We need to be able to look at them and be able to take care of them to ensure that the COVID does not become a problem or a distraction to them at this point. There are some very simple examples of things that could be looked at as we think about reopening. What is the hospital capacity? What is the clinical workforce that is available? How fast is data going to be collected? How fast is data going to be communicated to people who have to make decisions? And this is going to require a very high level of agility. So we're going to have to trust other people to be able to make decisions that we can use in real time to be able to move on and safeguard the lives of people. Again, this is another slide. It talks about economic relevance as we look into the reopening versus the risk of contagion. So we're looking at people in the agricultural sector, for example. Economic relevance, it's very important. We still need to eat. Lots of people are used to 3 meals a day. We still need to feed them 3 times a day. There was a study that was done by the United Nations Economic Commission for Africa. If you look in that study, you see they looked at Kibera in Kenya, for example. One of the big complaints was people suffered from hunger. That was a very, very important complaint. So we still need to feed people. So the agricultural sector, in terms of economic relevance, it is very important. In terms of risk to contagion, it is very low. There are very few people out on the farms. And then you look at that and you come all the way down to economic relevance of people to travel and hospitality industry. That is a tricky area. But again, that's an area of high contagion. So that's an area that will be slow to reopen. We looked at this again. This is health systems readiness to open versus severity of viral spread. Very, very important. if the health system is not ready to open, and you think about the severity of the viral spread, if that's a very densely populated area and their health systems are not ready, then we don't want to think about opening areas like that or allowing the people to start moving. So this basically just says, looks at if the severity of spread is low and the health systems are strong, yes, then we can open. Now, but this, when you look at this for Africa, you actually see that severity of spread is high. We have very dense populations. Health capacities are low. So this is a situation where we want to be able to, each country actually has to look at what is the data they have. How many beds do we have to be able to hospitalize people? How many doctors do we have? How many nurses? What is our ratio for our first responders vis-a-vis our population? So in opening phase, readiness of the health systems, there are basically a few things. Availability of critical hospital supplies is critical. Critical beds, how many ICU beds are available? What are the testing rates in the different countries? How fast, how many tests are we doing? Do we have data on the positive tests? And what are the positive test rates to the total testing that is being done? What is the efficacy on doing a contact tracing? That's a really big part, the contact tracing. And confirmed COVID cases isolated. So we have people who are in self-quarantine. We have people who are isolated by institutional isolation. We really need to be able to ensure that there is some handle on how this isolation is done so that we can also curb the spread of the infection. In this regard, it is critical that decision-making is fact-based and data-driven. So we need to be, we need to just ensure that there is a basis to be able to collect the right kind of data so that we can ensure that there's a focus, a good focus on people's lives and livelihood. So we have a couple of things I'm looking at, things that we need to think about as we start, and accelerate the reopening systems. Yes, people used to say, I work very hard, so they slept in their offices. But now there is no office for you to work very hard and sleep in. We're all moved to remote work. So now if you work very hard, you'll be sleeping at home. So the old ways are going to have to stop. We have to start to organize a new form of distributed workforce. And then we have to just accelerate the best practices that we get from here. You go into a big organizations and the people in finance will tell you that, oh, we are in finance, we don't know what is going on here. And now we have to move away from the silos because we need to be agile teams. We need to make decisions quickly. We need to have a hub system for making decisions. So relying on traditional organizational structures is out the doors. That's something that has to stop. We now have to start looking at practices that speed up decision making because business still has to happen, government still have to run. And then we need to just accelerate transition to agility. Again, just in time was a big thing. I remember many years ago when I did my MBA, there was so much talk about just in time. But now we need to talk about, we need to move from just in time to just in case supply. We now need to, it's no longer just in time, but just in case as well. So we need to stop depending on single supply chain sources. We need to redesign our supply chain to optimize our resilience, but we also need to accelerate our transition to agility. We need to be able to decide on how fast we can change our suppliers. Simple returning and reimagining what is our business going to look like. Seeing the return, start imagining business in a new form, but also next sharing is we have to actually start thinking about what we are actually going to be. This is a slide that just talks about impact to the business world. The size of the circles are actually in $10 billion. And you look at what actually is going on here is the extent of business model disruption in terms of the depth and duration of the demand and the disruption. So you look at from the top right-hand side, you look at the retail business and what is going to happen with them in terms of how long choosing agriculture, in terms of the duration of the demand and the disruption to the demand versus the extent of the business. So again, looking at what some things that government needs to think about as we talk about the reopening, there are just three basic things. Resolve to immediate COVID challenges. What is the immediate challenge that we have today? Testing. Build resilience to respond to emergencies and continue essential health services. So there is going to be COVID. However, there is still HIV, there is TB, there is malaria that we still need to attend to. And then reimagine and reform health systems for the long term. Again, as I said earlier on, I think we need to be able to take this opportunity to develop and actually sit down in the situation rooms and actually be looking long term on how we're going to build structures that are going to be resilient and ready to respond to other epidemics as they come. So I never like to end any of these webinars without continuing, because COVID is still with us. COVID is going to be around with us for a while. I don't want to quote any time that people would look for me and say, oh, you said. But the early signs are temperatures, wash your hands at the minimum 20 seconds. You could wash your hands for a whole minute, that's good. But at least it must be 20 seconds. Sanitize. If you cannot have water and liquid soap, sanitize. Please wear a mask, wear a mask, wear a mask. And again, I must just add, if you did all of this, it does not substitute for social distancing. Social distancing is a very strong requirement in ensuring that we do not spread the virus. At this time, I'd just like to acknowledge some of my sources and thank them for the work that has been done. You could reach us, you could reach out to us, and we'll be very glad to have a conversation with you on any number of things, from how we could help you restart your business, how we could help you develop occupational health and safety things for your staff as they come back to work. We could also have a conversation with you on getting you certification to a number of standards. That's what we do as a business. So we'll be very glad to have a conversation with you on any number of things. However, for today, talking about the situation room, at this point, I would like to stop and entertain some comments, questions, or any remarks or additions that anybody listening out there would like to share with us. Thank you. Any questions, comments, remarks? Some things I might have left out? Remember, you could just raise your hand and we would, our technical room will show unmute you and you could say what you want to say. We'll be glad to listen to you. Can't hear you if you're speaking. Please, if you're going to speak, please just unmute so that we can hear you. Okay. I see a hand raised. It says Faith. Faith, please, if you're going to speak, just unmute. We'll be very glad to listen to you.
Can you hear me now?
Yes, certainly I can.
I was actually just thankful for the presentation. My name is Faith, Petroleum Authority of Uganda, and this has been quite informative and showing us how we're moving forward with COVID. Thank you very much.
Thank you very much. It was a pleasure to have you. I would actually take this opportunity to invite you to watch. We just did something on occupational health. And I think that's a very big one as companies and offices beginning to reopen. We really had a long discussion on some very small tips, zero-cost dollar tips on how we can safeguard our people as they come back to work. The people are the most important asset that we have, and safeguarding our people is important as they come back to work. So I'll encourage people who are listening today who have not watched our occupational and health safety return, to please do. You could catch that on our YouTube or our Facebook page. It's all there. Okay.
Oh, Prof.
I guess this must have been, I have one more question.
Hello? Hello, Prof, can you hear me?
That's Jackson. Jackson Gerard, please, if you would unmute, I'll be very glad to have a quick talk with you. Yes, Jackson, please unmute. Etienne, please just unmute and make your comments.
Okay, Prof, good afternoon. Good afternoon, Prof.
Hello?
Hello, can you hear me?
Yes, I can hear you now, please.
Good afternoon.
Good afternoon, yes. Yeah. You're calling us from somewhere in Nigeria.
Yes, I'm calling from Port Harcourt, Nigeria.
It's nice to have you.
Thank you, thank you. Yeah, the seminar has been very, very informative. I've really shared a lot in Nigeria. Our test ability from the chart is very low compared to the analysis of 100,000 per 100,000. And I don't know how we can make it better by improving our health sector. So if there's anything you can do to help us also from that end, you will actually appreciate that. Thank you for the seminar. It's a nice one. Thank you.
It's always a pleasure. It's always a pleasure. Thank you. As I said earlier on, the healthcare on the continent has certainly been stretched with COVID, and this is going to be an involvement. This is one time when the public-private partnership becomes really, really important, because government cannot do this alone. The private sector cannot do this alone, but a good relationship between the private sector, the public sector, and a great partnership is going to be able to go really far. And so this is a time when I think one of the first things I'm going to call on is for the Triple P to become stronger within the nations, across the regions. But also, I'm also going to call for a very strong support for us to be able to call on our ministers of health and our governments to be able to support Africa CDC, but also to be able to own up to our share of GDP relationships to our Ministry of Health budgets, because that is actually the beginning of us trying to build a strong infrastructure and trying to build a strong system for public health, first of all in our communities and then in our countries. So thanks very much, Etienne, for joining in, and I look forward to it. Okay. Jackson, you still have your hand up. Are you, or you just clapping? Thank you so very much indeed. Thank you. Okay, it has been a great pleasure. I'm very glad to have had you. We look forward to having this conversation again next week. Last week, we looked at what goes on behind the scenes. This week, we've looked at what happens in the Situation Room, both sides, both from government and from the private sector. And next week, we're going to be delving into some more interesting and more exciting conversations. People have asked me before, why don't you tell us what we're going to talk about next week? Yes, I want to keep the suspense. I want to see you come back. I want you to find out what we're going to talk about, and then I'll invite you. See you same time next week, 3 p.m. Kenya, Uganda time. It was a pleasure. Again, you could see this. It's going to be up in the next 2 to 3 days on our site. You could go to our YouTube handle or our Facebook handle, and you'll be able to see this. James, that's the last one. Oh, James is also just clapping. Okay, thank you so very much indeed. Have a wonderful week, and look forward to seeing you same time, same place. Thank you.